Can you see my slide? Okay, so welcome to APSARA online lecture, and today's theme is Arthralgia. So this is today's content. First, I will introduce about myself, and I will share with you case 1 and case 2, and finally, I will give you key takeaways of today's lecture. First, I'd introduce myself. My name is Tomoko Kumakawa, and I belong to General Internal Medicine, Saitama Medical University Hospital. Saitama is next to Tokyo, so if you have any opportunity to come to Japan or Tokyo, please come to Saitama and visit to us. Okay, so let's move on to our case 1. So the patient was 71 years old man, and his chief complaint was light knee pain. The 2 days before, he came to our hospital, and he had light knee pain, and he had a fever of 37.8 degrees, so he took loxaporofen a few times in a day. He could improve his pain temporarily, so he judged that he didn't have to see his family physician at the time. And 2 days after, and the day of visit to our hospital, he could not walk for a long time and long distance either due to this pain. The patient went to family physician, and his family doctor referred to us for detecting the cause of persistent severe pain. When I asked him about his past medical history, he said that he had no significant past medical history and he didn't take any surgeries before. In addition to this, he has no drug allergy and he only took loxaporofen in these days, so he didn't basically have any medications. He didn't have alcohol usually, and he didn't smoke at all. He works as an office worker for daytime, and his family history was not remarkable. In his physical examination, his blood pressure was 120/7, and his heart rate was 85 beats per minute, and his respiratory rate was 20. He could fever up to 38.4 degrees, and he looked like feeling fatigue, but his consciousness level was clear. Besides, I could not catch the conjunctive icterius and pallor, and I couldn't hear any crackles and wheeze. It means that his lung sound was clear, and his heart sound was regular rate, and I didn't notice that murmur and gallops. His abdomen was soft and flat, and no tender, and no Murphy signs. However, when I saw his joint, his right knee joint was redness swelling and the joint had burning sensation. Alright, so what is the differential diagnosis so far? And what will you think about next? If you have any idea of your differential diagnosis, please write in your chat box.
So now we have chat box, so we can use the chat box. So if you come to think of any differential diagnosis, please write down the chat box, right? Then make sure that your message will be delivered to all the panelists and attendees, not all the panelists alone, okay? So I'm waiting for results, okay? Okay, now we have several answers: septic arthritis and gout, acute arthritis, rheumatoid arthritis. I think that's good differential diagnosis. Now we have plenty of answers. I think Dr. Kumakawa can comment on some like these chat box, and also
Yeah,
you can continue.
yes, thank you for some great answers. Yeah, I really love your ideas. So, okay, let's move on to next my slide. So, oh, wait a moment. So this is the first point of my lecture today. So when you see a patient with joint pain, please check to see if there is any inflammation in patient's joint, because this is a border of arthralgia and arthritis. Arthralgia means a pain in joint, and arthritis means that it have inflammation in the joint. So if the patient have an arthritis, they need treatment. This table shows the difference of arthralgia and arthritis. In terms of pain, the patient with arthralgia, their pain is getting worse and worse with movement. On the other hand, the pain of arthritis is getting better with movement. Regarding to the physical findings, you can notice that the patient with arthralgia have no swelling, no redness, and no heat burning sensation. But the patient with arthritis have swelling, redness, and heat sensation in their joint. So please imagine the patient with osteoarthritis and rheumatoid arthritis. You can anticipate these symptoms as well. So let's go back to our case. Now you can see that he had a redness, swelling, and heat sensation in his joint, so he had an arthritis. So let's think about an arthritis. So when you see a patient with arthritis, please ask that the pain had occurred suddenly or gradually. In addition to this, don't forget to inquire patients that pain happens in monojoint or multiple joints. This table may helpful to complement about the information of patient. So O means onset, and P means position, and Q is quality, and R is radiation, S is severity. Severity, when you want to ask about patient about severity, 1 to 10 scale is very handy. Like from 1 to 10 scale, 10 is the worst pain in your life. How much is your pain? It's very easable to understand the patient's pain. And T means time and time course, and A is short for aggravating and alleviating factor, like is there anything that makes the pain better and worse for patient. Okay, so let's go back to our case. So the pain started in 2 days, and his position was his painful position was right knee joint, and his quality was dull. He had no radiation pain, and I didn't ask the severity for him, but he told me that he could not work for long distance and long time, and he told me that his pain is continuous and persistent, but he is getting better with loxaporofen. So this is the second important slide of my today's lecture. When you listen about the time course and the number of painful joints, you can consider disease like this table. Typically, you can understand that acute arthritis are emergency. There are so many differential diagnoses of chronic single joint or chronic multiple joint arthritis. So please keep in your mind, like don't miss your joint tuberculosis, osteonecrosis, and just catching rheumatoid arthritis, systematic lupus erythematosus, and polymyalgia rheumatica. So the most urgent disease is acute and single joint arthritis. If you, if you see this kind of arthritis, you should treat patient as soon as possible. Because some types of arthritis, such as bacterial arthritis, may destroy patient's joint. their joint will be necrotic, so we have to stop it. So what will we have to do next? So let's order the imaging, such as X-ray or CT scan or MRI, and if it is available, let's try to joint aspiration. In our case, he told that his pain happened in 2 days, so we can judge that this is acute arthritis. And so I decided to take X-ray. After that, I can see a slight linear change in his knee joint. It means that calcification. And I punctured the joint and I got a synovial analysis. And you can find calcium thiophosphanate crystal may be identified in your joint. So I made diagnosis Pseudogout. So what is the difference between gout and Pseudogout? And this is the difference of gout-Pseudogout table. And actually, the patient with gout is imaginable easily, like this picture. The stereotype of a patient with a gout is fatty male who have drank a lot and have diabetes and dyslipidemia. The most common joint of gout is big toe, and serum uric acid is high, and you can see the X-ray is normal. And when you do joint aspiration, you can see urinate crystals such as this sticky shape. On the other hand, Pseudogout is typically common among elderly women. The favorable joint occurs in large joints such as shoulder, knee, and serum uric acid is normal actually, but you can see that calcification in X-ray, as we saw before. So let's move on to our case 2. So the patient was a 35-year-old man, and his chief complaint was left knee pain. So this is the history of present illness. A month before, he went to his dental clinic because he had a pain when he eats foods. Then he had bad teeth, so he had to remove these teeth. 2 weeks before, he had a fever to 37.5 degrees and he felt fatigue. He noticed that he could not eat meal as well, but he generally well, so he spent his life and he usually worked as well as usual. A week before, he had left knee pain and the pain was getting worse and worse. After that, he had also pain in his right clavicle joint. The day of visit to our hospital, he felt nausea and vomiting. After that, he could not talk with his family, so he transferred to our hospital. He had no significant past medical history, and he had no history of surgery. He didn't take any medication at all, and he had not known drug allergy. He didn't drink alcohol, but he smoked cigarettes 2 packs per day. His family history was also not remarkable. So regarding his physical examination, blood pressure was 86/54 and his heart rate was 106 and rhythm was regular. Respiratory rate was 26 and body temperature was 39.4 degrees. And his consciousness level was E3, V3, M5. In addition to this is another physical examination. I caught the normal change except for the sign of murmur on cardiac apex area in his heart, and I caught that some red spots in his fingers. He feels pain in left knee and right clavicle joint. So both joints have redness, swelling, and heat sensation. He also have tenderness when I gently touch his joint. So what is your differential diagnosis so far?
Thank you, Dr. Kumakawa. So now you can again write your differential diagnosis on the chat box. Again, you should send the chat to both panelists and all attendees so that other participants can see your answers, right? So this case, what was his age again? Like 60 something?
35. 35.
35-year-old man with multiple joint pain, with fever. His vital signs are a little bit worrisome, like low blood pressure and tachycardia. So I have seen similar cases before, but all the patients are really like in a bad situation. So I really like this case patient is really kind of worrisome. But anyway, like we have several answers. We have already got lots of answers here in chat box. Okay, I read them through. Reactive arthritis, septic arthritis, rheumatoid arthritis, septic arthritis, gout, pseudogout, bacterial arthritis, rheumatic fever, reactive arthritis. So most of them are like reactive arthritis and dissemination bacteria or septic arthritis, I guess.
Thank you for your answers. So, okay, let's move on to our next slide. Thank you for your answer in our chat box. So let's go back to our basic. So now you can ask patient as follows. When you see patient with arthralgia, first let me check to see that is there any inflammation in the patient joint, and second, be sure that the pain has started certainly or gradually, and third, ask the patient that how many joints they feel pain, a single joint or multiple joint. So in this case, he had redness, swelling, and burning sensation in his joint, so he had an arthritis. And secondly, the patient pain had started within a week, so he had relatively sudden and acute time course. Finally, he had pain in his left knee and clavicle joint pain, so he had multiple joint pain. When we think about acute and multiple joint arthritis, commonly caused by bacteria and viral, and the beginning of chronic multiple arthritis. For example, bacterial arthritis is caused by infectious endocarditis or gonococcal infection. In terms of viral arthritis, hepatic virus, HIV, and parvovirus B19 infection are common. Then I ordered X-ray, and this is a sample of joint area. You can see that the color of inside the bone is getting faint and pale. This shows that the joint is starting necrosis. I could available for joint aspiration, and the glucose in aspiration fluid was 1. So based on the physical examination, his body temperature was high, around 40 degrees, and he had shock blood pressure around 90/60, and his respiratory rate was 26, so his respiratory rate was faster than usual. His Glasgow Coma scale was E3, B3, M5, so he had alerted his consciousness level. So I considered that he had an septic arthritis and start treatment as soon as possible. After that, his blood culture were positive for all samples, and we found that abscess by transtracheal endocardiography. So final diagnosis was septic arthritis caused by infectious endocarditis. Septic arthritis mostly infected by Staphylococcus aureus like MSS-8 and MRSA, and Streptococcus like Streptococcus pneumoniae. How is septic arthritis triggered? So there are three ways of infection for septic arthritis. First one is by bloodstream from other infectious source. As you know, this case meets this way. In the first place, the patient may have infectious endocarditis and then suffered from septic arthritis. Second one is by connective tissues such as skin, muscle, or fat around the joint. If the skin or muscle have inflammation and infection, they spread to the joint and they spread to the joint and it leads to septic arthritis. And third one is by injection or surgery in or near a joint. By injection in a joint space directly or joint replacement surgery, sometimes it will infect directly to bone. So please keep in mind these three ways. So this is my last slide of my presentation today. The most important things were trying to confirm the difference between arthralgia and arthritis, and ask the patient about time course that the pain begins suddenly or gradually. If the patient has arthritis, please be sure to ask that the patient have monoarthritis or multiple arthritis. Finally, acute arthritis is sometimes urgent, so let's try to manage it as soon as possible and avoid to be necrotic that joint. Thank you for your listening.
Thank you so much, Dr. Kumakawa. So now all of you can ask any questions, leave comments in the chat box or Q&A button. So I think Dr. Kumakawa made a really important point by showing very typical cases in patients with arthralgia. I remember when I was a junior resident, I saw a patient, like 50-year-old female, brought to the emergency department with right knee pain. Then, like, she had a fever and she had her inflammatory markers were elevated. So I made a diagnosis of a pseudogout and I gave her NSAIDs and tried to, discharge her. But 1 hour later, she also complains of like left ankle pain. Then I realized, oh, it's different from, it's not like pseudogout. So I did aspiration and it has bacteria. So the patient had, septic arthritis. So it's really difficult to differentiate septic arthritis and like pseudogout or gout. So as you explained, like joint aspiration is extremely important. I think we cannot get diagnosis of pseudogout or gout without performing joint aspiration. And thank you so much for your lecture. Dr. Kozuma, do you have any comments or questions?
Yes, thank you. First of all, very today's topic is very important and very educational for me too. Actually, now I saw a lot of patients like knee pain or a multiple joint pain, but most of the cases, my OPDs are not so severe case. But during before my emergency department situation, several patients had high fever with joint pain, and several times very emergency case what happened. So, in my opinion, first of all, my opinion is the first impression is very important. Several patients is a chief complaint is knee pain, but actually not so severe. But if patient has not only knee pain, but other symptoms, for example, fever or uh, ornamental status or joint pain is multiple like this, I think this is an emergency case or a severe case. So mono joint pain is sometimes severe but a rare case in my impression. Briefly, thank you.
Thank you. Now we have one question. So could you please tell me about COVID-19 infection arthritis? And plus, please compare with chikungunya arthritis. Actually, I've never seen patients with chikungunya arthritis, so I'm not sure about that. But Dr. Kumakawa, do you have any comments about like COVID-19 arthritis?
Yeah, thank you for your question. I think that I saw some reports that the the arthritis with COVID-19 is there are many way of like multiple or single acute or chronic. So all pattern meet of COVID-19 arthritis. But I feel that the most commonly COVID-19 infection is mono and acute arthritis. So this is just my opinion, but I feel that COVID-19 infection feel monoarthritis and time course is very acute, I think. And in addition to this, I'm sorry, I have never heard of chikungunya arthritis, so I'm sorry, I have no idea about this disease.
Okay, thank you. I think COVID-19 can cause flu-like symptoms, and it include arthralgia, like general arthralgia. So patients can complain of knee pain, like any joint pain. I think that's common symptoms that can be related to some fatigue, difficulty walking. Um, I've seen some patients complaining of back pain. So I think that's a common symptoms. But actually, personally, I've never seen patients complaining of like acute monoarthritis. Or Dr. Kumakawa, so did the patient have like arthritis, like inflammation in the joint, or is that just pain, so like arthralgia?
I think maybe arthritis. I saw a report of arthritis of COVID-19, but I have never seen in person with COVID-19 patients. So I have not have experience with COVID-19 arthritis, but I just only saw some reports of COVID-19 arthritis.
Okay, thank you. So it can be relatively rare, but I think there are some patients. Thank you. Any other questions or comments? Any like comments or questions are fine. We can just wait for a moment.